Dr. Sandy Middleton, you have presented a randomized controlled trial in stroke patients. What intervention did you test?
We developed 3 clinical protocols based on evidence supported by our National Stroke Foundation Stroke Clinical Practice Guidelines around fever, hyperglycemia and swallowing dysfunction management. We then tested the implementation of these protocols by supporting their introduction through the use of workshops to develop multidisciplinary support, to identify barriers to implementation. We had education sessions at each of the 10 intervention sites, and we also used reminders in the form of site visits and email and telephone prompts.
How many hospitals was involved in this?
There were 19 acute stroke units in our main large tertiary referral hospitals in one of our states in Australia, our most populous state.
And what did you find?
We had over 600 patients in this trial, so it's a very large cluster randomised controlled trial, and we found that patients who were admitted to stroke units who had been randomised to receive our intervention were 16% more likely to be alive and independent 90 days after their stroke. They also had improved physical health component summary score on the SF-36, and they also had reduced temperatures, reduced glucose, and significantly improved swallow screening within 24 hours.
Yeah, so this was quite a good effect size on this study.
That's exactly right. There are only 3 proven treatments for stroke: aspirin, thrombolysis and getting to a stroke unit, and our intervention had one of the largest known effects that's non-drug or non-organisational in terms of improving patient outcomes. So it's very significant. Also, it's one of the very few nursing studies ever to show that good nursing care can actually impact on those hard endpoints of death and dependency.
But these findings are about a bit surprising, because you should think that this intervention was, since they are included in the clinical guidelines, that nurses already do these interventions. That's
exactly right. And that's why this is an example of implementation research. We took best evidence from the guidelines and wanted to implement it. And in fact, when we went round to the stroke units and explained what we want them to do, they were very accommodating, and they said, we're already doing this. But we did actually have a look in our pre-intervention cohort to see, in fact, whether they were already doing it. And in fact, only 21% of patients were receiving paracetamol at their first febrile event. Only 59% of patients were actually getting 1 glucose measurement within 3 days of hospital admission. Only 33% of those who had a reading above 11 received any insulin, and only 24% of patients were actually getting a swallow screening within 24 hours. So although every nurse should have been doing this, they clearly weren't following the guidelines for these patients.
And I understand that this study is published in a high-ranked journal.
Yes, we were delighted. We were fast-tracked for publication in The Lancet. It took 5 weeks from submission to be in print, and the article was published in November of 2011.